Hi, this is Vanita Jones doing my AK practical. We start out with the 19 muscles. So first I'm going to do the latissimus dorsi. You have my patient hold. And then I'm going to do supraspinatus. Hold. And then we're going to do serratus anterior. Up here, thumb up. Hold. Observing for scapular motion. We're going to do anterior delt. Hold. Middle delt. Hold. Posterior delt. Hold. And then we're going to do subscapularis. Hold. Infraspinatus. Hold. And then we're going to come down and do teres minor. Just like this. And then hold. And then we're going to do rhomboids. And we're going to hold down here. Hold. We're observing for scapular motion. We're going to do levator scapulae, down and back, and hold. Observing for scapular motion. We're going to do coracobrachialis. Hold. And then next I'm going to have my patient lie down on her back. And we're going to do pectoralis. We're going to do pectoralis major sternum. Over here. Have my patient hold. And then pectoralis clavicular. Hold. And then put this hand down. Raise this shoulder for me. We're going to do pec minor. Hold. Okay. And then pec face that way. Sit up, face that way. And then we're going to do the upper trap. Raise the shoulder up. And this ear to this shoulder. And we're going to rotate it slightly away. And then have you hold for me. Hold. Okay, and if I can get you to lay down on your stomach for me. And now we're going to do the lower trap. So put this up here. And hold for me. And we're observing for scapular motion. And then we're going to do the middle trap. Hold. Observing for scapular motion. And then we're going to do teres major. Put this elbow up for me. And hold. Okay. And my muscle that I have is upper trap, so if I can have my patient sit up and face that way again. And I'm just going to run through the 5 factors. So first we're going to check the nerve. If I can have you take your left hand and take a broad contact on your back of your neck. And lift this shoulder up and this ear down. I'm going to rotate slightly away. And we're going to see if it gets stronger. And it does. We're going to come back to that. Next we're going to check the neurovascular point. And I'm going to have the patient touch on this side, right above the zygomatic arch with that head. Exactly. Can you raise the shoulder up and that ear? I'm going to rotate away slightly. And can you hold for me? And it's still weak. And then we're going to do the neurolymphatic point, and we're going to go to the lateral aspect of C1. Right here. Have the patient touch right there. Lift this shoulder up. Thank you. And hold for me. And it's still weak. And we're going to do CSF. Can you take a deep breath in for me? And lift the shoulder up. And hold. Deep breathe out. And hold for me. Okay, and that's still weak. And we're going to do the AMC. And that one is the posterior aspect of the 12th rib. So if I need you to reach with this hand to this side. Yes, right there. Lift the shoulder up, this ear. And hold. Still weak. So now we're going to go back and deal with the nerve. So I'm going to find a good indicator muscle. So I'm going to stick with the middle deltoid. And I'm going to see if it's strong. And I'm going to do autogenic inhibition on it to see if it weakens. And hold. And it weakens. And we're going to wait a couple of seconds. We're going to see if it's strong again. And it should be. And it's strong. So we're going to use this as our indicator muscle. So now I'm going to have the patient do a broad hand contact. And we're going to do this. And it should weaken. And it does. And then we're going to find the segment that causes the muscle to get weak. Use a single finger and put it on the spine. So I'm going to check to see which one makes it weak. That's still strong. Go with the segment for me. Hold. That was still strong. And that's weak. So C5 is what makes it weak. So now I'm going to go in and rebound test it to see which side I need to adjust on. So I'm going to push on the right side and push P to A. Hold. Still strong. I'm going to push on the left, P to A, on the trabecular pillars. And it goes weak. So I would set up and adjust on the left side. But my patient